Good day, my name is Kimberly Domingo, and I will report about the coronavirus update as of March 17, 2020. And in this video, I will state about my opinion about the coronavirus. A pneumonia of unknown cause detected in Wuhan, China was first reported to the WHO country office in China on December 31, 2019. The outbreak was declared a public health emergency of international concern on January 30, 2020. At the end of December 2019, Chinese public health authorities reported several cases of acute respiratory syndrome in Wuhan City, Hubei Province, China. Chinese scientists soon identified a novel coronavirus as the main causative agent. The disease is now referred to as coronavirus disease 2019, or commonly called as COVID-19, and the causative virus is called severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. It is a new strain of coronavirus that has not been previously identified in humans. The initial outbreak in Wuhan spread rapidly, affecting other parts of China. Cases were soon detected in several other countries. Outbreaks and clusters of the disease have since been observed in Asia, Europe. In summary, on February 11, 2020, WHO announced the name for the new coronavirus disease, COVID-19. WHO characterizes COVID-19 as a pandemic on March 11, 2020. Speaking at a COVID-19 media briefing, the WHO Director General said, "WHO has been assessing this outbreak around the clock, and we are deeply concerned both by the alarming levels of spread and severity, and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic." Pandemic is not a word to use lightly or carelessly. It is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by this virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus, and we have never before seen a pandemic that can be controlled at the same time. According to CNN Philippines report, the Philippines saw another two-digit jump in its COVID-19 cases, with the health department reporting that the total number of patients with the viral disease has reached 142. The health department reported Sunday 29 new patients with COVID-19. They did not immediately release details on the new patients. Among them is a 13-year-old girl from Quezon City who is the youngest patient who tested positive for the disease in the country. 13 of the new cases had no known contact with the COVID-19 patient and had no travel history abroad, while 3 were confirmed to have been in contact with someone with the viral disease. Most of the new cases are admitted in different hospitals in Metro Manila, except for a 21-year-old woman who was admitted at Davao Regional Medical Center and a 47-year-old man who was admitted at Silang Specialist Medical Center. Most of the COVID-19 patients live in Quezon City, with 22 of them residing in Metro Manila's biggest city. 15 patients take residence in San Juan City, while another 15 live in Makati City. COVID-19 is a disease caused by a coronavirus called SARS-CoV-2, which is related to the virus which causes severe acute respiratory syndrome, but is not as deadly, with the fatality rate standing at around 3%. According to the World Health Organization, 80% of patients only experience mild illness and eventually recover. It added that some 14% experienced severe illness, while 5% were critically ill. The disease is spread through small droplets from the nose or mouth when people infected with the virus cough or sneeze. To prevent infection, authorities are urging people to practice regular hand washing, cover the mouth and nose when coughing and sneezing, and avoid close contact with those who show respiratory symptoms. Commonly reported COVID-19 symptoms are fever, dry cough, and shortness of breath. Those with severe and critical symptoms should call the health department at 028651-7800, local 1149-1150. Global, Malaysia imposes nationwide movement control order. The order includes a comprehensive restriction on movements and public gatherings, including a ban on all religious, sports, social, and cultural activities, reported the state-run Bernama News Agency. All houses of worship and business premises will be closed except for supermarkets, wet markets, grocery shops, and convenience stores selling daily necessities. Most government premises, except those providing essential services such as water and electricity, will be closed, Bernama reported. All educational institutions will also be closed until the end of the month. Malaysians will also be banned from traveling abroad, while foreign tourists and visitors will be restricted from entering the country, it added. Los Angeles will stop issuing parking tickets for the next 2 weeks, mayor says. Los Angeles Mayor Eric Garcetti said the city will stop issuing parking tickets for the next 2 weeks effective immediately. Speaking at the news conference on Monday, Garcetti said there are more cars parked on city streets because people are working from home or are taking care of others. More on Los Angeles. On Sunday, Garcetti ordered the closure of bars, nightclubs, entertainment venues, and gyms until March 31 in an effort to prevent the spread of coronavirus. His order also limits restaurants to take-out and delivery orders only. Georgia Governor Brian Kemp ordered all public schools to close starting Wednesday until March 31. His full statement: to keep our students, teachers, and administrators safe and mitigate the spread of COVID-19, I am ordering the closure of all public elementary, secondary, and post-secondary schools in Georgia from March 18, 2020 to March 31, 2020. This measure is critical to reducing local transmission in communities across our state, and I ask Georgians to continue to follow best practices, washing their hands regularly, isolating the elderly and chronically ill, and avoiding large events if possible in the days and weeks ahead. All schools in New York ordered to close by Wednesday, governor says. New York Governor Andrew Cuomo directed schools to close statewide by Wednesday until April 1. School districts statewide will be required to submit a plan to the state education department. As of now, work and public transportation are suspended and establishments will be closed in the whole of Luzon, as the government placed Monday the entire island under enhanced community quarantine to contain the spread of COVID-19. Presidential spokesperson Salvador Panelo told CNN Philippines that the enhanced measures against the viral disease are effective immediately, but the government will give allowance to people who will have to go home from work. Panelo said exempted are frontline health workers, authorized medical officials, and those traveling to get basic necessities, as well as for medical or humanitarian reasons. Government offices have to maintain a skeletal workforce, he added. All establishments will also be closed, he said, but supermarkets will remain open and ATMs at banks will remain operational. As of today, the Philippines currently has 187 cases, 12 deaths, and total of 5 recovered. People started to complain because of the inconvenience that the COVID-19 is causing. Many people in the Philippines now are being furious with the government's leadership and the executive orders that they are announcing. Because of the implementation of the enhanced community quarantine around the island of Luzon, various people now cannot go to their provinces or somewhere else because of the strict implementation of this order. It has also caused many people to have trouble when it comes to their jobs, especially people that are engaged in restaurants, malls, public transportation, and many more. These are just some of the problems that we are facing now as a country. But if we just see the good cause of the orders that we need to follow, now is not the time to complain and cause social issues against the government. The executive orders that is implemented is meant for our own good, to stop the spreading of the virus, because in reality, our government is mindful that we don't have that much medical facility to cater to the needs in those in need of medical assistance, especially if the spread of the COVID-19 will spread even more. Remember that prevention is better than cure. Yet, in all of these things, we just need to remember that God has a plan for our country. May we realize the statement from Ms. Faith De Los Santos that in less than 3 months, the virus is already considered as pandemic. It has been 2,000 years, yet there are still many countries who have not been infected of the gospel. May we endeavor to make the gospel pandemic for the cause of Christ. Government officials. It is our duty as citizens of this country to pray for our government leaders and as well as our frontliners, which is the doctors and the nurses. It is also the time that we need to realize how little our time is. to share the gospel to others. May this be an encouragement and a challenge for us Filipinos and as well as followers of Christ.